Hi, I'm Ann. Thank you for joining me for this brief tap on pain. So I invite you to find your collarbone and gently massage, looking for an area that's a little more tender than the surrounding tissue. Okay, now I invite you to scan your body and notice where you are feeling pain or discomfort in your body right now. And then take a nice deep breath with me with a long exhale. Yeah. Okay. So please rate the intensity of this pain on a scale of 1 to 10, with 1 being almost no pain and 10 being excruciating pain. Just notice where you're at. Okay, now I'd also like for you to tune into the quality of this pain. So is it burning, aching, stabbing, cramping? Does it come and go? What is this pain in your body? Take another deep breath with me with a nice exhale. Great. Okay, now I invite you to repeat after me and change any of the words that you need to personalize this to your experience. I'm going to start by tapping on the top of my head, also getting the back, the occiput. So this pain, I choose to acknowledge this pain that I'm feeling in my body. Deep breath, exhale. Let's move to the eyebrow. It's not comfortable to live with this pain. And I'm choosing to acknowledge that this experience has not been easy for me. Deep breath. Exhale. Side of the eye. This pain that I'm rating as and what did you rate it as? Deep breath. I feel it in and really tune into that part of your body where you're feeling it. Let's go under the eyes. I'm choosing to acknowledge that this is something that I'm dealing with, even though I'd rather not be. Under the nose, I'd much rather be feeling pleasure and ease and motion in my body. Deep breath. But that's just not my reality right now. Under the lip, and I'm open to the possibility that it just might be okay for me to be experiencing this, at least in the short term. Deep breath. Let's go down to our chest. There's another part of me that does not want to deal with this at all. Part of me is angry that I'm even dealing with this. So I'm choosing to acknowledge this anger and this frustration that I'm dealing with this pain. Deep breath. Top of the head. Part of me is also a little afraid. What if this pain is a sign that something deeper is going on, maybe going wrong? Let's go to the eyebrows. I'm choosing to love and accept myself, even if this pain is signaling that something is wrong. Side of the eye. What if this doesn't get better? What if this gets worse? What if I need surgery? Under the eye. I acknowledge that I have some fears around this pain, and I'm open to the possibility that that's okay. Just because I have fears does not necessarily mean that they're going to come true. Under the lip, and I'm open to the possibility that in this moment, this pain is sending me a message. And tune into your body and just see if this pain might be sending you a message. Is it to slow down? Is it to be more mindful with your movement? Is it to put less strain, or maybe take a break, do something with less repetition? Deep breath. Now let's go down to the chest. And on the chest, I invite you to just imagine how you would soothe a little scared baby. If it was crying, wouldn't you just kind of pat it and reassure it? So now I want you to imagine that it's not a little baby that you're reassuring, but it's the youngest part of you, the most vulnerable part of you inside your nervous system. So we're not trying to tap anything out, but we're trying to reassure ourselves. Top of the head. So even though I'm dealing with this pain, I'm open to the possibility that there's a message for me here, that there's a lesson for me here. Go to the eyebrows. And now I invite you to tune in again to that part of your body that is in pain, and just reflect on all the ways that this part of your body has served you, all the things it does for you. Deep breath with a long exhale, side of the eye. And I invite you to send a huge wave of gratitude and love and compassion to this part of your body that's hurting under the eyes. I'm choosing to acknowledge this part of me that's struggling right now. Under the nose, I'm choosing to support this part of my body, to listen more deeply, to show up for this part of me in ways that I haven't been doing fully. Under the mouth. And even though it took this pain to get me to listen, to change my pattern, maybe that's okay. Let's go to the chest. I'm choosing to take better care of myself now. Good job. So now I invite you to tap all over your body and thank yourself for giving yourself this attention, for taking this time for yourself, for your body, for your healing. And now tune into that part of your body again and just notice. The intensity may have changed, it may be the same. Just check in and notice if anything has shifted. And if you need to do this again, it's here for you. Great, thank you so much.